This program is intended for informational purposes only and does not contain medical advice. As always, please contact your physician or qualified healthcare provider with any questions regarding a medical condition. Welcome to Hot and Bothered. I'm your host, Melyssa Ford. This is the space where we get real about sexual health, wellness, relationships, and all the life-affirming conversations that remind us what it means to live fully and authentically. Nothing's off limits. Everything is on the table. So let's dive in. Let's take a minute for a public service announcement that honestly should have happened years ago. The FDA just removed the big, scary black box warning from hormone replacement therapy. The same warning that made an entire generation of women terrified to treat their menopausal symptoms. I am filling with rage as I think about it. Turns out that warning was based on older women, outdated hormone formulations, and data that doesn't match modern science. Imagine suffering through hot flashes, night sweats, brain fog, and vaginal dryness, and the 80 to 100 other symptoms because a decades-old label told you HRT would take you out. The new guidance actually reflects what clinicians have been saying quietly for years. When HRT is started early in menopause, the risks are lower and the benefits are real, and I can attest to that. This is what happens when we update the science and stop punishing women for wanting to feel like themselves again. I wanted to tell you guys a little story, but before I do that, this episode's going to go a little bit differently. Over a year ago, I went to a friend's med spa called the V-Spot. I'm sure you guys have seen me post some content about the space, and it is literally like one of the most glorious places that you could find yourself in when it comes to dealing with your sexual health and wellness. They had all kinds of treatments and products and services that just kind of help you navigate this time. And one of the services that they provided was they would give me HRT in the form of a pellet being implanted in the side of my buttock. So what I decided to do, because I love to serve myself up as a guinea pig, is I decided to film the entire process. My doctor, Monica Grover, there's a specific pellet that she likes to use. And until they start paying me, I'm not gonna tell you which one it is. No, I'm kidding. It's probably in the episode itself. But she discusses all of the different forms of HRT because the pellet, unfortunately, is not covered by insurance. A lot of HRT is not covered by insurance. Hopefully that's going to change. But the reality of the situation is the type of hormone replacement therapy that I get is cost prohibitive for the majority of people. So we wanted to give you guys a brief education as to all of the different forms of hormone replacement therapy that are available to you and give you a little bit of education as to what hormone replacement therapy actually is and what it isn't and why that study itself was so flawed and so detrimental that we're going to be playing catch up for several years because of what was done. So I just want to be clear on how insidious those warnings were on HRT products. I saw a post recently that said that the FDA's removal of HRT black box warnings isn't heroism. It's an admission of 20 years of crimes against women. Women were gaslit and told HRT was dangerous. Doctors taught to fear it. Research funding dried up and women suffered in silence. And now a label change with no apology and no accountability, like poof. These are the protections that hormone replacement therapy provides to women that were denied to them for over 20 years. Reduced all-cause mortality, lower cardiovascular disease, protections against dementia, prevention of osteoporosis and fracture, improved metabolism and weight stability, reduced inflammation, better sleep, mood, and mental health, preservation of muscle and bone and brain, and basically a higher quality of life and vitality. The WHI's flawed study and misleading headlines led to FDA black box warnings and worldwide fear with a massive drop in access to HRT. The flaws included using the wrong drugs, the wrong dosage, delivery method on the wrong population, which led to the wrong conclusions. It affected and shaped global health policy for decades. The removal of the FDA's black box warning, like I said, is not heroic. It's proof of how disastrously women's health has been handled. We deserve better, and we deserve the truth. I know what my symptoms were when perimenopause came to me. I felt like I didn't know myself anymore. I'm interested to know, and you can probably drop in the comments, what you went through when you discovered that you were going through perimenopause. Or did you even know? Because it's not like, our moms and our grandmothers and our aunties really talked about this, because menopause has been an experience in a woman's life that's been shrouded in so much secrecy and shame. So I don't think that a whole lot of us were prepared for the onset of these symptoms and how to manage them. And so can you imagine a whole generation of us not being able to have access to this? We're lucky that this is now the trend, that menopause is having its moment and everybody is talking about it, which is wonderful, but it's just highlighting how many women suffered in silence for years and years and years, and how the medical industry, by and large, ignores us during this pivotal moment in our lives. This episode is not an endorsement of hormone replacement therapy. That is for you and your medical professional to discuss between the two of you. What I want for you to do is I want you to advocate for yourself. I hate to hear the stories of women who have been gaslit and said, well, menopause is just a normal process, and whatever you're going through, you're gonna have to suffer through it. That was not my experience. I had incredible healthcare professionals who listened to me when I talked, and they prescribed to me what they felt I needed based on all of the lab work that they did, and all of the conversations that they'd had. So my advice to you is just to advocate for self when it comes to wanting to return to a sense of normalcy in your own life. So let's get to it. Here's me getting a pellet stuck in my butt. Oh, that sounds crazy. So today I am at my favorite spot, the B spot, Medi Spa, and I am getting some hormone replacement therapy. What is that, you ask? Well, we've talked about it a lot. Refer to the second episode with Dr. Soni Javed. Such a rock star. I love her. We're going to have her back for season 2. But HRT is something that we need as we get older. Our perimenopausal years start to feel very, very, shall we say, disorienting. That is a very diplomatic word for fucking crazy. And what made me start to feel better is when I started to replace the hormones that are naturally being depleted. That's estrogen, testosterone, and progesterone. So today I'm going to get some hormone replacement therapy in the form of a pellet. It is actually going to be implanted in my backside. So you guys are going to be here to see all that stuff. And then afterwards, we're going to talk to Dr. Monica Grover, who's actually going to be doing the implantation. And we're going to go over a couple of the other ways that you can get hormone replacement therapy that is maybe a little bit more non-invasive, and also more cost-effective, and also covered by insurance. So we're going to talk about that a little bit later, but right now I gotta take my pants off so that I can get this little situation done, which you guys are going to be in the room for. So give me a second. I'm getting numbed first because, like I said, this is actually an incision being made in my butt cheek, and the pellet's going to be implanted in it, right underneath the layers, a few layers of skin.
Into your glutes.
being implanted into my glute muscle. Okay, numb the shit out of me.
Just move forward a little bit.
Like that? Okay, so let me get into my perimenopausal journey for you guys and see if you see any parallels to things that you might be experiencing, symptoms and that sort of thing. So when I was 41, my mom told me, just an FYI, I started going through menopause at 42. It'll probably happen for you too. And so I was literally like, what does that even mean? Because that's all she said. And I didn't ask any questions like, well, what does that mean? Well, what does menopause mean? What did you feel? I just didn't ask any questions. Well, I was soon to discover what the fuck she meant. And my first symptoms showed up in strands of hair falling out in the shower. And also crypt keeper like dry skin. My skin has always been supple and radiant and smooth and plump and naturally moisturized, and that is not the way that it was feeling at all. So we've got hair loss, dry skin, I want to talk about the low libido, anxiety, depression, night sweats. The night sweats came in like I don't even know what to call it. And it was almost daily, where I would wake up 6 to 7 times a night, and I would wake up in a panic. My heart would be beating so fast, and I had this fucking song playing in my head constantly, like, what was the song called? Time keeps on slipping, slipping, slipping into the future. And I'm like, oh my God, this is the fucking worst. And I wake up, the bed would be soaked with sweat. It just was gnarly all the time. I didn't know my ass from my elbow. I'm gaining weight. Nothing I do is gonna stop it. Like, no amount of Pilates, strength training, dieting is working. And I just felt like out of sorts. I would just look at myself in the mirror and like, I did not know who this body belonged to anymore. I didn't know it anymore. And I started to talk to my primary care physician. She suggested that I talk to my gynecologist about hormone replacement therapy, and that's what I did. And he started to educate me on that, and that started my hormone replacement journey hormone replacement therapy journey. So I've done multiple different things. I've done the transdermal creams that you put on the inside of your arms. There's a spray, never used that before, but I've heard about it. There's estradiol patches that you can put on where you take progesterone supplements at night that help you sleep. So these are some of the ways that women take hormone replacement therapy. The one that I'm doing today is usually not covered by insurance, and a lot of times it can be very cost prohibitive. So these are the things that I wanted to say that would be placed in the cons list. The pros list is that you don't have to apply it daily. You don't have to apply a patch weekly. You get to just get it implanted and forget about it for the next 6 to 8 months. All you have to do is just take your supplementation daily and you're good to go. But the cons is that it's usually not covered by insurance, and it can be somewhat cost prohibitive. So that's part of what I wanted to let you guys know more about, is what's covered by insurance, what probably isn't covered by insurance, what the costs look like if you do it out of pocket, and just what the benefits and the drawbacks are. So I'm just waiting for my butt cheek to get numb and for my doctor to come in to start this process. And when she does it, it's usually about 5 to 10 minutes. Very quick, very easy, pretty painless. And that's it. So I'm doing this updated, it's not a survey, but it's basically, I'm just filling out an updated form, right? and one of the questions is, which best describes you? I am sexually active. I want to be sexually active. I have completed my family. My sex has suffered. I haven't been able to have an orgasm. God, that would be fucking shit. I am trying to have a baby. Nope. I may be pregnant. Not unless it's Jesus. Let's see here. So what am I? Am I sexually active?
Are you?
I want to be sexually active. My sex has suffered. Any problem orgasming? Well, I need a guy to do that. Well, no, actually, I don't. No, I don't have a problem. Do you have any problem? Nope. I need glasses. Have you had an abnormal pap smear? Who the fuck hasn't? Yes. Do you experience vaginal looseness? What the Monica? Vaginal looseness?
Just say no, because let's say like a potential date is going to like
Right?
watch it. Yeah, just say no.
No, she's right and tight, okay? I got a Kegel thing in here
Exactly.
right now. No. Are you currently taking any of the following medications? I'm on statins.
When were you placed on that?
So I had, and I can say this. So I had a calcium, because this is something I encourage some of you to do, since heart disease and stroke is like the #1 killer of Black people. We have a higher prevalence of having it and not knowing it. So I got something I got the CT calcium score.
Great.
So basically it was like they shoved me in an MRI machine, hooked me up to like electrodes and stuff like that, and basically what it does is it looks to see how much plaque has calcified in your arteries. Yeah. And when my doctor got the results back, he was just like, I was actually kind of surprised, Melyssa, this moderate. And I was like, what? And he said, I have to put you on cholesterol medication right now. I said, what?
Does it run in the family? Like,
Well, I mean, I was 15 when my dad died, but I just remember fucking nothing but pill bottles next to his nightside table. Now that's me. My dad always just seemed to have something fucking wrong with him. So I don't really know, but my mom ended up having to get a stent.
oh.
And what does that mean?
So yeah, there's like potentially coronary artery disease there.
Yeah.
How old was she?
So my mom would have been somewhere in her 50s. I'd have to.
And coincidentally, like perimenopause and menopause just increases your risk of cardiovascular disease. So by doing the hormones, but also like, doing like these proactive measures and preventative measures of like going on statin, even though on your labs, like your cholesterol might actually look normal, is actually a really good way to like, deter even more of that happening. Because it sounds like there are definitely some familial risk factors.
Yeah, so my familial risk factors currently is colon cancer. So this May I have to get my second colonoscopy, so that'll be like my second one in 3 years, which is another cancer that affects Black people more prevalently than it does any other race, specifically Black men. So that's why I urge you all to go get your colonoscopies. And so now that I've discovered that both my parents might have had some like heart disease or like the beginning of it, now I have to treat my high cholesterol with medication rather than just dietary and exercise, which is what I do.
And now that we're like just delving more and more into like medicine and like just like the new science and the technology out there, it's we're just learning so much more about inflammatory pathways, and those are like precursors and indications of coronary artery disease or colon cancers and so forth. So there could be even like a genetic mutation that could make you more prone towards inflammation. So doing the hormones and doing these other screenings and being proactive is now cutting down your inflammatory risk too. That can cause other like even diabetes, which is all part of like that whole process of cardiovascular disease.
And so hormone replacement therapy helps with that as
to
well.
help mitigate it, the right type of hormone replacement therapy for sure. Because as we age, when the hormones decline, that can actually set off pro-inflammatory pathways. So by now taking those hormones, which are known to reduce that, you're now extending, like you're just helping to improve the longevity of your life, but also help tone down any types of risks that could be caused by inflammation.
Okay. See, look at everything you guys are learning today on my visit to get my HRT and stuff like that.
I'll go get the pellets.
Okay.
No.
Ooh, you're gonna be able to see what the pellet looks like before it's put in.
So you know the rules, right? Working out, at least with the lower body, from today until, I would say, Saturday.
Oh, damn. I can't work out until Saturday.
Shame.
Shucks, darn it to
Lower
heck.
body. Lower body.
Yeah, well, it's total body in my gym, so I'm just not even gonna bother. Whoops. Yes, I think I can manage.
Yeah, I know, what a shame.
Yeah, I think I can manage. My doctor is concerned for my modesty, which I'm not usually. I forget to be modest so much of the time. Like, oh, what? A guy just what? What is that in there? That looks really scary from here in the packaging. Right by your hand. What's that?
Oh, those are the tools. That's how the good stuff goes in.
Yeah. Okay. So we're gonna do some extra numbing with the lidocaine, right?
Mm-hmm.
Okay. Holy. See the size of that needle? You see that? Oh my god. Okay, that's extra numbing.
This is the worst part.
Okay, it is.
Just remember.
Oh.
I know.
Ah.
Really is the worst part. So lidocaine will always sting a little bit because it is acidic, but it has a quick thing.
Yeah.
Nothing you can't handle.
This is the same butt cheek that I got, like the doctor who came to see me in Mexico. He gave me like, whatever he gave me, it was pain relief right away. But boy, do I still feel the injection site.
So he was convinced that you had norovirus, or?
There was a little bit of a language barrier.
Yeah.
Okay, yeah, it is. I mean,
You make a little incision. You shouldn't feel anything though, just maybe pressure at the most. Okay.
yeah, there was a little bit of a language barrier.
Yeah.
So I don't know what the hell was happening.
So this is one of the instruments we use to help insert the pellet. Do you feel anything?
No.
Good.
So I was trying to like explain as best as I could with my, limited.
This is an estrogen pellet. It's very, very small. It's 6 milligrams that I'm putting in there.
Is it estrogen and testosterone?
Yep, you're also getting testosterone. This is a testosterone pellet. It's one of them, and you are getting another testosterone. We love our testosterone.
We do love testosterone.
Okay, so yeah, what were you saying?
Before you came in, I was trying to explain the different methods of hormone replacement therapy. So this is the pellet,
Yeah.
which, tell tell them a little bit about the pellet.
So the pellet is a bioidentical hormone that is plant-based, and it looks like a little rice grain, as you saw, a little bit smaller than that. And the nice thing about it is that it actually has 99% bioavailability, so it will be the most effective method of hormone delivery, and the levels stay at a nice rise and a plateau for about 6 to 8 months. So whereas when you take other types of formularies, whether it's bioidentical or synthetic hormones, when you do like your patches, your creams, your gels, your suppository sprays, maybe it's about 35 to 50% bioavailable at best. So your body's not actually utilizing all of it. So this is how, honestly, a lot of patients feel they're most optimized when they do a pellet delivery.
There's a little bit of a controversy with the pellet, you think? You've heard? Or is there?
So I think there's just controversy surrounding hormone replacement as a whole. And I think that that has a lot to do with
Misinformation that's been out there forever and ever and ever.
Exactly.
Telling women that putting estrogen in their bodies while they're perimenopause will cause cancer. That is such an antiquated misnomer. It has been proven false. It has been debunked. It is bull. The faster that you start hormone replacement therapy when you enter into perimenopause, the better off you will be. I cannot tell you how the vast majority of my symptoms subsided once I started hormone replacement therapy and found the one that worked for me, which is this one.
And the nice thing about the very specific brand that we use, they probably have the most clinical data out there when it comes to like hormones, but as much as like pellet therapy.
What brand is that?
It's called BioT. So we've worked with, in the past we've had patients that have actually worked with other brands and it just wasn't doing what it's supposed to be doing. And then they felt how they were optimized with this specific brand. So, you know, anybody can compound pellets. That's just another way of a formulation that's being delivered. But really what ingredients are going in there, what's the ratio, how much research has backed it up, that's really important when it comes to hormones, because it's been so heavily stigmatized, like we wouldn't want to contribute even more towards that, right? So we always want to do the most responsible approach. Even with synthetic hormones, there is a black box warning of like you can't really go past 3 to 5 years, which is such a disservice for women. So but with bioidentical, and especially if it's the right kind, you can actually use it indefinitely.
Wow. I did not die. See, I'm learning as I go along too. This is what the journey, entails, is like speaking to your medical health professionals and asking as many questions as you possibly can so that you are armed with the information to live a long, healthy, vibrant life, because I will be damned if society is going to tell me that I lose my juju just because I'm a certain age. I'm sorry, I'm so colorful with my language.
Tell it like it is.
Yeah. Okay. All right. So we're done.
We're done.
We are done. Look how quick that was.
So we're gonna send you over some of the progesterone.
Okay.
And like I said,
Good, because I'm about to run out.
Okay, good. So yeah, we'll definitely have enough supply of that. And the thyroid, we'll be in touch with that. Just let me know how those biopsy results will come back as.
Okay.
I'm sure everything will be fine, but just for reassurance, and then I'll definitely give you some of the thyroid once that's back, and that will also really help you feel your best as well. Okay.
Thanks.
All right, Melyssa.
Okay, so that is it. I got my pellet, my hormone replacement therapy pellet, injected in my little butt cheek, and that's gonna last me for the next 6 to 8 months. And during that time, I will get regular blood panels just to see where my hormone levels are, where my iron is, where my cholesterol is. My God, it's interesting getting older. Let's just say that. You really have to stay on top of things. But, when I have a place like this and doctors like, Dr. Monica Grover and Cindy, who's the owner here, well, they help me stay on top of everything. So stay tuned. I'm going to be producing a whole lot more content like this for you guys that is educational, informative, entertaining, fun, and all that good stuff. Mwah. Love you guys. Well, I hope you guys enjoyed that episode. I really enjoyed making that for you guys. As always, I love to use my own lived experiences to try to inform you on anything that you might have questions about or concerns about, or you just never even heard of it. You know, what was HRT? Most people didn't even know what that was until maybe like 2 years ago. But hopefully this will encourage you to advocate for yourself, have the conversation with your healthcare professional as to whether or not HRT will work for you, and encourage you to also do your own research on HRT, the history of HRT, how far back it goes, and whether or not this might be beneficial to you. By my own personal experiences, it has been a godsend. So I want to leave you guys with that. So that's it for today's episode of Hot and Bothered. Remember, life is lived in the in-between, and that's usually where it gets the hottest. Until next time. Thank you for tuning into Hot and Bothered with Melyssa Ford. Please rate, subscribe, and comment, and share wherever you get your favorite podcasts. This season of Hot and Bothered with Melyssa Ford is hosted, written, and executive produced by me for Forged Path Productions. This season was written and produced by Sebastian Godin, filming and editing done by Freddie Chica, Nicole Benante, the Bassi Group, and Emmanuel Martinez, and executive produced by Rachel DeSalvo.